My name is Christina Bennett, and I'm the Communications Director for the Family Institute of Connecticut. You have my written testimony. I'm here to offer opposition to HB 770. I believe it's part of a coordinated attempt in a national campaign by abortion rights group, specifically NARAL Pro-Choice Connecticut, to discredit the work of pregnancy centers. One campaign is even titled Expose Fake Clinics. While examining pregnancy center websites, would you please examine NARAL's website accusing centers? It's www.exposecpcsconnecticut.org. If they only want to regulate centers with deceptive advertising, then why does their website have a map of all Connecticut pregnancy centers, along with a description of them being fake women's health centers? They share information on all Connecticut centers, including their website and the hours they are open. In the last 2 weeks, a pregnancy center in Virginia was vandalized with the words fake clinic spray painted over their signs. The accusations that centers exist to deceive women are serious, which can put pregnancy center staff in potential danger. In the past, I served as a staff member at a pregnancy center, and I witnessed attacks from NARAL. They protested outside of our center in Middletown, causing the center to have to close for the day and cancel appointments with clients. They've sent volunteers or spies into centers to create their bias report, and we've received fake Google reviews on social media. NARAL submitted testimonies and research must be examined in light of the fact that they are not a neutral, unbiased organization. They are an abortion rights group opposed to the core beliefs of pregnancy centers and those with pro-life views. This is evidenced in their statements when they claim pregnancy centers exist to deceive women. Would the committee take seriously anonymous testimonies accusing abortion clinics of false advertising that were collected by a pro-life organization and their team of volunteers? I would imagine you would take their opposing views into consideration. Last year, during a similar hearing for HB 5416, NARAL staff said the words pregnant need help were deceptive. They believe any reproductive health organizations that don't offer abortion or refer are deceptive. This belief does a disservice to women by not acknowledging the multiple ways in which pregnant and parenting women need help. My own mother was pressured into scheduling an abortion here in Hartford at Mount Sinai Hospital in 1981. She received no information on other options, though she was visibly upset. Thankfully, a hospital janitor saw her crying and asked her if she wanted to keep her baby. She left the hospital after being forcibly told to stay by a doctor. She would have loved to go to a pregnancy center if she knew about one. That's why their advertisements are so important. There are no clients who've testified against the centers, no complaints to the Better Business Bureau, Department of Consumer Affairs, social service organizations, though many clients who go to pregnancy centers also visit social service organizations. Because NARAL Pro-Choice Connecticut is championing this bill attacking centers and has submitted research for this testimony, I want to respectfully voice my concern about the fact that Senator Lesser's wife is listed on NARAL's website as a board member. I hope pregnancy centers will have an impartial investigation in light of any elected officials' connections to this organization who is championing this bill. Connecticut is one of the most accessible states for abortion in the entire country. We don't even require parental notification for minors seeking abortions, although parental notification is required for minors seeking tattoos, piercing, and to go tanning. Women in Connecticut have more accessibility to abortion than most of the entire country. What they need is options and support. That's what pregnancy centers offer to them. Please oppose this legislation that unfairly discriminates and targets pregnancy centers.
Wow, you covered a lot of ground in 3 minutes. Was there more? Okay, but still really close. Thank you for your testimony. I will assure you that this committee is taking into account all points of view, and that we haven't made up our minds on anything yet. That's the whole purpose of the public hearing process. Senator Lesser?
Ms. Bennett, thank you, Mr. Chairman. Ms. Bennett, I have to take issue with what I guess I interpreted as your comments a minute ago. I think all of us are serving on this committee because we believe in the mission of the Connecticut General Assembly and our roles as legislators to advance and protect public health in the state of Connecticut. We're here, we've been here for over 10 hours in this committee room, serving because we believe in the mission of the state of Connecticut. And you can agree with us or disagree with us, you can attack us and whatnot. But I thought your comments with regard to my wife and her service as a volunteer member of a board unrelated to my service here in this General Assembly, I thought was out of line. And we can talk about this bill, and I'm happy to have a discussion with you about the bill. I'm not sure I understand why you brought up my wife in this hearing tonight.
NARAL Pro-Choice Connecticut is championing this bill. You're endorsed by them. In 2015, you won their highest award. I came to your office and talked to you about that when I was working at a pregnancy center, and you said, in quote, "I don't even know why they gave me this award. I work with many organizations." I never knew that your wife was a board member. So I think that it's relevant. It's on NARAL's website, and they're talking about pregnancy centers' websites. They're examining pregnancy centers' websites. I think that's important. I never said that you will rule in a certain way based on that. I'm just bringing up that information in case anyone wants to know that I think it's relevant. They're championing this bill. They're about to give a bunch of testimonies on behalf of it, and there's a very personal connection you have with the organization, as well as being a recipient of one of their highest awards. And so I want to make sure that pregnancy centers are getting a fair hearing, because I care about people, and I know that you care about people, and I want to make sure there's no political preferences in regards to this bill.
Ms. Bennett, I think you're
We're not allowed to clap.
There may be some new people here who weren't here earlier. We're very careful in this committee not to indicate favor or disfavor of anybody testifying. For the very least, I'm sure everybody here understands that, so as not to intimidate anyone. So I would ask that no matter how passionate you are about the issue, that you refrain from expressing it publicly for the benefit of all those here. Thank you. Representative Cook?
Thank you, Mr. Chairman. I had absolutely no intention on making a comment on this. I've had meetings in my office regarding this conversation. I do, though, take issue with anybody that comes in front of our committee and testify and brings our family into it.
Even if they're a board member on the group that's bringing up this bill?
No, hold on. I'm not trying to be rude, disrespectful, or inappropriate, but I am trying to state one thing. It is not our families, whether they be spouses, significants, or otherwise, that are sitting in this chair making decisions. It is us. It is us that are elected, and it is us that take the heat for everything that we do, not our families. And I am a firm believer, first and foremost, that our families must come first. Whether it be our spouse, our children, our parents, it doesn't matter. There is a time and a place for that conversation, but to bring someone's family member into a conversation regarding of the topic is totally inappropriate in my world, and I would ask that it not happen again.
I can respect that. I mean, I disagree, and I think if not now, then when would I ever be able to bring that up? And I think it's important for people to know that, but I respect your opinion.
I'll just add before I hand it off that I have to concur with my colleagues on this. One would argue that politics has infected every aspect of our life, and it's almost impossible for us to dismiss it. But in my experience, even in the context of politics, you cross the line when you start talking about family members. I think the points that are made is we stand by our records, we stand by our words, but we do not involve family members in this. And I would hope that in this committee room, as we try to practice, even in the context of campaigns, we keep families out of it. And whereas you may feel it's relevant, it is definitely, in my mind, crossing a line. Senator Summers?
Yes, thank you for your testimony.
Welcome.
I just wanted to assure you that many times legislators, if they feel personally a conflict, they have an ability to recuse themselves from a vote. We have that in my Senate, where people are voting on energy bills, and some of them work or are affiliated with Eversource. So I am confident that my fellow senator would, if he felt there was a conflict, would make that decision, and that's his decision. And again, just wanted to reiterate, just because a family member, my husband's a physician, that doesn't mean that I'm going to be voting for everything that physicians want. And I would not want anyone to infer that I would, as I'm sure Senator Lesser feels the same way. I don't want to speak for him. But I just wanted to let you know that we do have that ability as legislators if we feel that we are conflicted. And I just wanted to make sure everybody knew that here. And I do think, although for you it was important for you to point out the relationship, it is very difficult as a legislator to have people assume that just because your child or your spouse is involved in something that reflects on you. So I just wanted to let everyone know that there is an ability for legislators, should they feel conflicted, to not vote on something. Thank you.
I understand that, and I apologize if I offended. I mean, I brought it up in light of the fact that when I met with Senator Lesser, he said, I don't know why you think I'm associated with this organization. And then to find that out, what felt very confusing in light of what he had said. And so, but again, any other questions?
Are there any other comments or questions?
I just want to make a comment about the fact that I think that there's going to be very emotional testimony going on here for the next few hours, and that many of us have been in this room for a very long time, some since the very start of this. And so I want to make it very clear that it is important that we have some boundaries about what is said here in this room and the way it is said. And I agree with my colleagues in terms of what some of those boundaries need to be. So I hope that as we move forward, we remember that and that we are respectful of one another and the opinions that we share here. Thank you.
Thank you, Senator. Any other comments or questions? I want to say that since you were the first to speak to this point, perhaps you didn't understand. I hope it is clearer as we go forward. I think the old maxim is treat others as you'd like to be treated yourself. So hopefully that will be something that everybody thinks about when they come to testify. Many people have waited long hours to testify, and let us move on. Oh, Representative McCarthy.
Thank you, Mr. Chairman. Yes, I just wanted to thank you for the other parts of your testimony and for coming up and speaking to what really you were passionate about. Thank you.
Oh, you're welcome. And I do agree. I hope that you guys will treat pregnancy centers as you want to be treated, because that is very important. That's why we're here. Thank you.
Totally agree. Thank you. Next up is Sarah Croucher.